When shopping for health insurance coverage, are my medicines covered is one of many questions consumers want to answer. To see what a consumer has to do to find out if her medicines are covered by a specific health plan, we searched for health plans available in South Dakota. We used healthcare.gov for our search because South Dakota uses the Federal Healthcare Exchange. We narrowed the search to zip code 57501, Hughes County, and said we had an income of $51,000 a year to see the full cost of premiums. This notice alerts us that the premiums are just estimates based on the limited information we provided. We then identified as a 52-year-old non-smoker in a single-person household. "35 health plans are available in that zip code, offered by 3 different insurers. We narrowed our search to just silver plans, since those have been the most popular with consumers. There are 18 silver plans available. We looked at the 2 with the lowest premiums, each from a different insurer. For the first plan, we go to a web page that lists several options. A consumer needs to read very carefully to determine which link to pick, and the terms used are very technical. For example, options include small group, transitional extension, large group, grandfathered plans, and make reference to non-ACA compliant plans and ACA compliant plans. It's very confusing. Though we weren't certain exactly which one to choose, we decided to choose the 4th option on the list as an educated guess. The link opens a file with a list of covered medicines organized by therapeutic class. The introduction to the document says that the information contained in the formulary is provided solely for the convenience of medical providers. Given that description, it's not surprising that the list is organized by technical therapeutic class names, such as anti-neoplastics for cancer medicines, and then subdivides those categories into very, very specific medical terms, like anti-neoplastic enzymes or radiopharmaceuticals even within those cancer medicines. This is not a consumer-friendly list. A column for drug tier lists numbers, but there's not a description in the document explaining to the consumer that those numbers relate directly to the out-of-pocket costs a consumer pays for each of the medicines. Also listed are abbreviations for limits on accessing the medicine, such as step therapy or prior authorization. There's not a description as well of those terms in the document. To estimate out-of-pocket costs, a consumer needs to go back to the plan documents and refer to the Summary of Benefits document. Looking at the Summary of Benefits document, there's not information about tier levels. However, this plan requires a 50% coinsurance on any medicine other than a generic one, so interpreting the tier levels for this plan is less important than in other plans where the out-of-pocket costs may vary by tier level. Let's go back and take a look at finding the list of covered medicines for the lowest premium silver plan from a different insurer. Clicking on the drug list takes us to this page with a link to the list of covered medicines and a disclaimer up front indicating that the plan uses a 6-tier formulary, but that healthcare.gov only facilitates a summary showing 4 tiers. The disclaimer informs the consumer that they need to refer to the plan summary to get specific copayment amounts. The search page offers a drop-down menu to select medicines by therapeutic class. But like the first insurer, this list also does not use consumer-friendly terms. Again, antineoplastics and technical subcategories are used for cancer medicines. A consumer would have to look under blood glucose regulators and then select anti-diabetic agents to see diabetes medicines that are covered. The document includes references to all 6 tier levels. To determine what the tier levels mean in the document in terms of co-payments or co-insurance, the consumer needs to review the Summary of Benefits document. In that document, there is a co-payment for Tier 1 for this health plan, and then it's the same level of coinsurance listed for Tiers 2 through 6. What may not be obvious to consumers is that this insurer uses one list for covered medicines for all the plans it offers in the healthcare exchange. You cannot buy into a more generous list of medicines by selecting a gold plan, for example, instead of a silver or bronze plan. Though you will lower what you pay for medicines, the insurer just has the one list. So if your medicine is not on the list, you'll pay most, if not all, the costs out of pocket. The same may be true for the first insurer as well, but given the confusion of finding the right formulary for the plan, we cannot be certain.